birth. What causes preterm birth?
There are some known causes of prematurity, preterm births. Supposing a mother has twins or triplets, or if she has a lot of amniotic fluid, the water surrounding the baby, or if she has other medical conditions like high blood pressure or diabetes, and then that puts the mother at risk of having a preterm baby. But in more than 50% of cases, we don't even know why the mother has a preterm birth.
So what are the most common health challenges that a premature babies face during the first week of their life?
So a baby right after birth may not breathe, so we may have to assist the baby in breathing. Because the lungs are immature, these babies tend to have difficulty in breathing, so we need to take them to the ICU and give them some breathing support. Since their stomach and intestine are not very well developed, we cannot give them a lot of milk at a time, so we have to give them some IV fluids and start minimal amount of tube feedings. The babies also have a very immature immune system. They don't have the mechanism to protect themselves from disease, and because their brains are very fragile, they might be bleeding in the brain. Sometimes their hearts are very weak. They don't pump blood adequately throughout the body. So these are some challenges which they face immediately over the first 3 or 7 days, and moving forward they tend to remain in the ICU for a long time. The more premature the baby, the smaller the baby, they may remain in the ICU from anywhere between 1 or 3 months, and during that period it's a roller coaster. The parents also have a very difficult time because they have to be with their babies for 1 month, 2 months, up to 3 months sometimes. So it's a very emotional roller coaster for the parents as well.
When you talk about the care for the preterm babies, we are also gonna have to talk about how important this early intervention are, and even after they are out from the ICU, they will have to do follow-up, right?
Yeah. So the Bhutan Every Newborn Action Plan envisions that all babies not only survive but also thrive and realize their full potential. So for that, a baby has to not only survive the initial NICU period, a preterm baby has to survive and also be able to see, hear, be able to walk and be functionally independent, and also talk and have a normal intelligence. This is what we call an intact survival. So for that to happen, after we discharge the baby from the NICU, we keep them on regular follow-up, sometimes every few months, sometimes up to 6 months if everything is going well. We keep them on follow-up for at least 2 years. And during that period, if we find any delays in terms of their walking, their talking, or movements, then we put them on either physiotherapy, occupational therapy, or speech therapy, so that they can catch up with their other peers. It's very important for parents to bring these children for follow-up so that we can catch these developmental delays early and put them on intervention early.
How much is our neonatal care system equipped to manage complications associated with preterm birth?
There are only 3 neonatal ICUs in the country, which is in Thimphu, Mongar and Gilifu. And apart from that, there are some the hospitals which we call cluster hospitals, which have pediatricians, but they are not really equipped to have a neonatal ICU. And even the neonatal ICUs in Mongar and Gilifu are not as well equipped as we are in Thimphu. So from an equity and justice point of view, we would like to have all the newborn ICUs at the same level. So for that, with the Ministry of Health and the National Medical Services, we are trying to come up with a standard of services. So what level of services and equipment and medication should be there at each level of facility, what kind of babies and patients they are supposed to take care of, and also from a capacity building point of view, what are the nurses and doctors, what are the trainings that they are supposed to get.
What steps can an expectant mother take to reduce the risk of preterm birth?
So we would suggest that all couples plan their pregnancies, they come for the preconceptional care, and screen the mother for any medical issues. If she has any medical issues like high blood pressure or high blood sugar or heart disease or kidney disease, those conditions need to be optimized before she gets pregnant. And then after she gets pregnant, she should come for all the antenatal care visits, the 8 recommended visits, and take all the supplements. For example, since last year, the Ministry of Health has started something called maternal micronutrient supplement, which is also proven to be very beneficial to reduce prematurity. And since last year, we have started something called low-dose aspirin for high-risk women. So women who are at risk of developing high blood pressure in pregnancy, we put them on low-dose aspirin right from a few months of pregnancy till they are 36 weeks, so that they don't get the high blood pressure, and then thus we can prevent prematurity. And apart from that, mother needs to be healthy overall, so she should take a nutritious diet. She should stay away from all the substances like alcohol, tobacco, smoking, and also doma.